Are you dealing with constant foot pain that just won't go away? Maybe your hip aches after a long day or your back pain seems to get worse no matter what you try. Here's something your doctors might have missed. It could all be coming from one hidden cause, a leg length discrepancy. Today I'm going to reveal why this often overlooked condition might be the real source of your pain, how to identify it, and most importantly, how to fix it. Stay tuned because what you learn today could finally explain years of mysterious pain. I'm Dr. Andrew Schneider, a podiatrist in Houston, Texas. Every day in my practice, I see patients who've been everywhere trying to find the source of their pain. Often, they're surprised to learn that a difference in leg lengths is the hidden culprit behind their symptoms. Before we move on, take a moment to like this video, subscribe to help others find this important information. Let me start with something that might surprise you. About 70% of people have some difference in their leg lengths. But here's the key. Not all leg length differences need treatment. What's crucial is understanding when the difference is causing problems and when it needs attention. Think of your body like a chain. When one link is off, it affects everything else. A small difference in leg length can create a domino effect, causing your ankles to roll, your knees to strain, your hips to tilt, and your back to compensate. In my Houston podiatry practice, I often see patients who've tried treating each of these symptoms separately without success because no one identified the root cause. There are two types of leg length differences, and understanding which you have is crucial for proper treatment. The first is what we call structural or anatomical difference. This means the actual bones in one leg are shorter than the other. This can happen from birth, after an injury, or even after hip or knee replacement surgery. The second type is functional difference. This is when your legs are actually the same length, but muscle imbalance, joint problems, or even the way you stand makes one leg appear shorter. This type often responds very well to treatment, and I'll show you exactly how we address both types in just a moment. In my office, we use several specific methods to diagnose leg length differences. We start with a standing evaluation, checking your pelvic alignment and how your body compensates. We'll also take measurements when you're lying down, comparing specific anatomical landmarks on each leg. Sometimes we need to go deeper with imaging studies. A standing pelvic X-ray can measure the tilt of your pelvis, showing the amount of limb length difference. This is particularly important if you've had hip or knee replacement surgery, where leg length differences are surprisingly common. In fact, about 30% of patients experience some degree of leg length difference after these surgeries. Speaking of post-surgical leg length differences, let me share something important. If you've recently had hip or knee replacement surgery and notice a difference in your leg lengths, don't panic. Your body needs about 3 to 6 months to adapt to the new alignment. However, if the difference persists beyond this period or causes significant pain, that's when we need to intervene. Now let's talk about one of the most effective treatments I use in my practice, custom orthotics with incorporated lifts. These aren't your typical over-the-counter insoles. These are precisely calibrated devices that not only address the leg length difference, but also correct any underlying foot mechanics that might be contributing to the problem. The process starts with a detailed scanner cast of your feet. We capture your foot structure in its optimal position and then add specific modifications to address both the leg length difference and any biomechanical issues. The lift component is built directly into the orthotic, distributing the correction across the entire foot rather than just the heel. This provides more stability and comfort than a simple heel lift. What makes these orthotics special is that their gradual adjustment capability. We often start with a slightly smaller lift than the full difference requires, allowing your body to adapt gradually. Every few weeks, we can adjust the lift height until we reach the optimal level. This prevents the muscle strain and discomfort that can come from correcting too quickly. If you're finding this information helpful, give this video a quick like, and let me know in the comments if you ever tried orthotics for a leg length difference. Long-term management is crucial for success. We typically schedule regular checkups every 3 to 4 months initially, then every 6 to 12 months once we've achieved optimal correction. During these visits, we'll evaluate how your body is adapting, check the wear on your orthotics, and make any necessary adjustments. For most patients, we see significant improvements within the first few weeks of treatment. However, complete adaptation can take 3 to 6 months as your body adjusts to its new alignment. During this time, you might need to modify certain activities. For example, if you're a runner, we may temporarily recommend to reduce your mileage or incorporate more cross-training. One question I often get is about shoes. With custom orthotics, and that includes lifts, you'll need shoes with removable insoles and adequate depth. I work closely with my patients to identify the best shoe options to accommodate their orthotics while matching their lifestyle and activities. The success rate with this approach is excellent. Most patients experience significant pain reduction within the first month, and by 6 months, they're often back to full activity. The key is consistency, wearing your orthotics regularly and following up with the recommended checkups and adjustments. If you're experiencing unexplained pain in your knees, your feet, your hips, or your back, don't wait to get it checked out. The solution is often more simple than you'd think. The link to request an appointment is in the description. Remember, understanding why you're in pain is the first step to fixing it. If you found this video helpful, please share it with someone who might be dealing with unexplained pain. Thanks for watching, and I'll see you in the next video.